Thanks, Brett. No more glasses, no more contacts. 1 month ago, I underwent LASIK surgery at May Eye Care in Hanover, and it changed my life. I know it sounds dramatic, but that's because it is. You're about to see parts of my LASIK surgery. Now, the video isn't very graphic, but it does show a bit of what went on. Here we go. Here we are, the final steps before my LASIK surgery, where I can ditch these for good. First up, some final measurements of my eye. I put on a fancy hat, and booties too, and then into the operating room I went. It actually felt more like a disco with all of the strobing colored lights. A bit of nervousness set in, but I followed directions and looked straight at the small light in the machine. Thank goodness for something to focus on. In went numbing drops, and after a few minutes, Dr. May began to work his magic, and so did the laser. No, it did not hurt. I couldn't feel a thing. And after just a few minutes per eye, up I went. It was different. It was a little scary, but overall good. Thumbs up. Thumbs up. And now the man who gave me this gift of sight, Dr. Carl May, is with us this afternoon. Tell viewers about my surgery. Was that fairly typical LASIK surgery?
Every patient is different and has different needs. Some people can't get the flap like you did, especially contact sports people, but for your average LASIK, yours was very typical.
That's good to know. Very typical. The flap was interesting going through that. What makes somebody a candidate for LASIK surgery?
Well, you have to have a stable prescription over at least a year, and you have to have a healthy eye. But the big thing that makes somebody a good candidate is how motivated they are to have a change in their life. They have to want to have a procedure that will get them out of their glasses or contacts.
Yes, and I was motivated,
You were.
absolutely motivated. Let's talk about how long the surgery takes and then the recovery time, because really it's not bad at all.
That's correct. When you have LASIK with a flap like you did, the typical LASIK procedure, the procedure takes your 15 minutes at the most in the operating room. The laser itself time is 15 to 20 seconds. And your recovery time, you're blurred for that day, maybe like you're looking underwater
Sure.
for 5-6 hours. And then it's clear the next day.
You know, and you just have to put drops in every few hours for the first 2 days and then for a few more days. But it's really, you want to put the drops in because you want to take care of your eyes. Not a big deal at all. And I did mention this earlier in my piece that the LASIK didn't hurt, and I bet that's something a lot of folks worry about.
Yeah, that's the most common question about the procedure. But we put drops in the eye that completely numb the eye. You do feel some pressure around your forehead where I'm touching your head, but in the eye itself, it's totally numb. You don't feel anything.
It amazed me that just numbing drops could do that. All I could feel, honestly, was the clamps a little bit, like on my cheek, but that's not what I was worried about at all. And a lot of my friends, they were shocked to hear that I had to keep my eyes open. They just thought that was horrifying, and I tried to explain, you know, it's not what you think. You're just kind of looking at a fixed object. Is that something that people are worried about too?
That's something they're worried about. If they had their eyes closed, that might be something you'd be interested in another 30 years or so. That would be like to lift the eyelids or something. We do laser on the outside, but
Oh, okay.
we have to have your eye open to actually operate on the surface of the eye, the cornea.
Right.
And the light is bright, similar to the lights that you use in a studio here, so you really can't see that much of what's
Right.
going on. It's such
No,
a
you
bright
can't.
light, and the light doesn't really bother you because your eye's numb and your eye's held open.
It is. What advice would you give folks who are considering this?
I'd tell them to come in and get a free consult, do some research on the internet, find a doctor that's experienced, and get information. You know, coming in for a free consult's the best way to find out if you're a good candidate and what it's going to be like for you.
Yeah, and I can tell you, it's great. It really is great. Put any fears aside. It has, like I said, dramatically changed my life. I had struggled with my contacts and my glasses so much, and this is like giving me so much freedom, and I thank you for that.
Are you glad you did it?
Oh, I'm so glad I did it.
All right.
So glad. Oh, you're the interviewer now, are you? Yes, I am very glad. How can we reach you?
You can reach us at mayeyecare.com on the internet or at 637-1919 by phone.
Okay, do it, everybody. Do it. Dr. May, please shake your hand.
Okay,
Thank you for this
thank you.
gift that you've given me. I love it.